Dr. Gowrinathan, welcome to Talking Acromegaly and Pituitary with Tony. It's a pleasure to have you join me today.
Thank you so much, Tony. I appreciate the opportunity to talk to people about this.
Let's get into it. Dr. Gowrinathan, you sit at the intersection of mental health and serious medical illness. When someone hears the words, you have cancer or you have a brain tumor, what happens psychologically in that very first moment?
Well, I think, you know, all people are different. So everybody has a different frame of reference. They're coming from a different place. They might be in different places in their lives. But I think the one really human component that everybody has is um, disbelief kind of comes first. Um, just like in grief, when we have a period of denial, um, it feels a bit surreal. It feels almost silly that anyone would say that to us because, as much as we understand intellectually that it can happen to anybody, um, having it happen to us is a whole different thing. So there's this initial time period where, after someone gives you a diagnosis, there's doctor's appointments and there's imaging scans, and I want to connect you with this, specialist and this specialist. And so we're going and going and going. But from that first moment when someone said something to us that really feels like it shouldn't resonate with us and doesn't make much sense, no matter how many symptoms we were having, we did not think this. Um, I think there's fear, but more importantly, there's a certain sort of lack of reality to that moment, right? And I think the reality doesn't set in until later.
For me, with my experience, the
Hmm.
reality did not set in when I heard that I had uh, a brain tumor. I went through the denial period that you mentioned. I had the disbelief. I even went through a period that I just ignored it and I wanted it to go away. From your
Yeah.
experience, what do patients feel that they don't always say out loud in that moment?
Well, I think that what people feel in that exact moment when you're getting diagnosed is very different from person to person outside of this like feeling of it not being real. But I know that some of the things that we try and take down for people when we do talk about it is there is a little bit of a feeling of betrayal, like our body or our brain, depending on where this illness is, has somehow let us down. And I think that comes from the idea that brain tumors and cancer are coming from our own tissues. So I always like to differentiate for people and say, listen, your body did a great job of getting rid of potential things, potential problems for many, many years. And this one problem kind of got through the gate, right? Because what we don't want is for us to now have a relationship with our own body that we're living in where we don't trust this body, right? We don't know it and we don't trust it because that's like a stranger showing up and being your roommate. So one of the things that people don't say out loud or even recognize is happening to them until we talk about it is this relationship with our own self, our own body, um, after someone has told us that this has been happening for a while.
Yeah, I totally feel uh, that wholeheartedly. Let me ask you
Mm,
this. A lot of people in my community with acromegaly, a condition that, changes the way you look, how you feel, and how others
mhm,
see you. What
mhm.
kind of psychological toll does that take on patients that you've seen over time?
So I think the part of acromegaly that's maybe specific to acromegaly and particularly difficult is two things. Number one, it can be kind of an insidious onset, like it comes on pretty slowly. So you were noticing things like our hat isn't fitting properly, or you look in the mirror and you're like, I look a little different. We think maybe we're bloated. We think maybe we, aren't eating well. Maybe we should change our diet. Um, we might have like other symptoms, physical symptoms, but we attribute them to sort of run-of-the-mill things, daily life. No one sits there and thinks, "I know, it must be that I have a pituitary tumor with acromegaly," right? Like, this is not within the wheelhouse of how we normally think. So I think, part of it is related to being told and then looking back and being like, "Oh my gosh, there was this, and there was this, and there was this." In hindsight, everything makes sense, but at the moment, I think what's really important is to understand that at the time, we couldn't have known. We knew when we knew, and before that, even though there were signs, we couldn't have known. It wasn't obvious enough. And the other hard part I find, particularly with acromegaly, is this is not a disease that people know well. It's not a disease that people understand. So, um, talking about pituitary feedback loops is not something that is in sort of layman, verbiage very often. If you say you have, like, for example, breast cancer, um, everybody can gather around that. Everybody understands the impact of that. Certainly we continue to try and create more support and awareness around cancers like that. But I feel like these kinds of conditions, which number one are sequelae to a brain tumor or something, but even if they're not, even if you just happen to have it, um, it's a hard one to explain. And so that means support wise, what we do is we tend to withdraw a little bit because how many times can you explain yourself to people, right? And how many times can they say like, "Oh, you just need to eat less sugar," or if you just exercise more, or if you stop eating bananas. I mean, I've heard it all. you know People's lack of understanding of the complicated endocrine systems involved means that it's harder to find support the way we need support. We might find support, but it might have to do with not eating bananas. And that might not be what makes us feel supported, right? So getting support and understanding, I think, is a particular challenge with acromegaly.
You definitely hit the nail on the head with saying you heard it all. There are so many friends that I have with acromegaly who, in hindsight, say, "Oh, I knew something was wrong. I didn't know that related to my acromegaly. I thought
Mhm.
at the time before my diagnosis that I was just gaining weight, that
Mhm.
things were just changing because I was getting older." However,
Mhm.
in hindsight, I do realize that my hands and my feet weren't getting bigger because I was working out more. I was gaining more muscle. And
Mhm.
I had never heard of acromegaly, and I just attributed things that didn't make sense to other things that didn't make sense, if that makes
Sure.
sense. Yeah,
We
because
all do
I couldn't.
that.
Yeah. So acromegaly is a word you never hear before your diagnosis. So you're thinking, for me at least, my thought was, okay, my endocrinologist that I first had didn't know much about it. So I felt it wasn't as important as it came to be. I didn't
Mhm.
realize the significance of acromegaly at that time. Moving forward, let me ask you this. How do you help
Mm.
people rebuild their identity when their body and sometimes their reflection in the mirror no longer feels familiar?
Mm. Well, I think first we have to grieve what we lost, right? So, um, we weren't this is not something that we ordered in the mail. This is not something we asked for. So the changes that come with it, changes, losses, um, are also not what we asked for. So there's a good bit of work to be done around grieving what isn't the same, being angry. We can be angry. This is not what we asked for. This is not what I wanted. I used to be so good at X, Y, and Z, and now I can't even do that anymore. Like, who am I without this thing that was, uh, for many people, their strengths, their talents, their things that made them who they are. if those change, sometimes we get stuck in that. And then you either feel like you don't have an identity or again, you feel like you're living with a stranger, right? Like this is not who I am and I don't really like this new person. I don't even know this new person. I don't want to know this new person. I want to go back to being me, right? So there is a certain amount of like processing of grief and loss around who we were. And then I believe in the baby steps that help us to see the strength that came from this adversity. And I say that with a great deal of um, humility because I have watched my patients and I've watched how hard it is to reinvent yourself and to find um, beauty or strength or meaning or purpose when things are ripped away from us or when our life is turned upside down. But I'll tell you, they do it all the time and they do it beautifully. Like it is so touching and is what keeps me doing this work. So I think the first step is really to understand that yes, happened and we didn't like it and it wasn't what we asked for, but truly, there are things to be gleaned from it that make us stronger and better and wiser. And then we can cultivate new strengths. That's the beauty of being human. We can always cultivate new strengths. Oh, aren't you a living example of that?
I am a living example of that. I have reinvented myself. I am a different person now. It took me a while to accept my new normal. I was angry. You mentioned angry. I went through an angry period. I went through a period of not feeling the same. I
Mhm,
lost my identity.
mhm.
I have brain fog to the point where I know I'm not the same person. However, I'm at the point where I am okay with the new me. I'm able to live with me. I've been able to start a podcast and help other people mentally to whereas they can help themselves, which I never thought I'd be able to do, Dr. Gowrinathan.
Isn't that so amazing? Isn't that so amazing that we can do things like that? That we can uplift ourselves um, by reinventing ourselves.
And it's harder for some
Mhm,
people than it is for others. When you come across a case that's really hard,
mhm.
how do you point that person in the right direction of reinvention?
You know, I think it would be arrogant of me to think that I am supposed to reinvent someone or I am supposed to um, somehow transform them. And I think that um, the hardest part is that as much as I want it for them, it has to come from them. But the thing that I can do is no matter where people are on their journey, even when they're in the stuck part, um, if you're in the stuck part and you're up to here in the mud, um, I'd like to think that the therapeutic thing that I'm able to do is get in there and be up to here in the mud with you until you're ready to step out. And then when you are ready to step out or when you have more hope or you feel stronger, and my medications are what help me get people a little bit stronger, and therapy, then I didn't step in without a rope. I came with a whole tool belt full of Indiana Jones type stuff, and we're going to get out. But there are some times when I cannot just fix it for you. I just have to sit there with you and see you and understand. And that is enough. That is enough until someone is ready for more. I
Is there a
hope. I
difference?
hope it's enough.
I hope it's enough too. Is there a difference in how patients process a visible illness versus an invisible one?
Yeah. 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 So we work a lot. I am the director of what's called Cancer Support Services. So we have all the wraparound services that help people get back to life. And one of our highest need populations is brain tumor patients with physical issues, like physical demonstrations of the disease. And another high population is our facial tumor patients. And that's because even if we take the tumor out, there will be residual changes to the way your face moves or the way you look, right? Um, you know, we are social creatures, so anything that announces a difference to the world is something that means we have to navigate differently. So, one of the really hard things about being stuck is people looking at me and going, I have young ones who are like, how can I date like this? How can I date? I have to explain myself every 5 seconds. Like, I can't do this. I can't go on a date. I can't talk. I can't, some people are very conscious of how they walk or the fact that they might trip or even the brain fog. Really, like if you're going for like a job interview or you want to present your best self somewhere, and then you have brain fog and you don't know whether it's going to pop up at that moment or not. And when we're nervous, it usually does. Um, all of these are things that become barriers, and sometimes they look unsurmountable. And so the physical part just means that there's a lot more social impact. So I look for people withdrawing from their families, withdrawing from socializing, withdrawing from work. Um, and these are things we have to take down because that withdrawal then makes us feel more broken and more inherently not able to do. So it is something that we work on. It is something that we sometimes have to even treat because people get so stuck that their brain needs medication to overcome this concept of, I can't go outside. I can't talk to people. The can't becomes a very big can't with a capital C, all the other letters capitalized next. And so sometimes, it really does take medication and therapy to surmount the brain's resistance to that.
Dr. Gowrinathan, you almost got me at the point where I'm ready to sit on your couch and kick my feet up. Giving, you are educating me on another level of mental health that I didn't realize I needed until we started this conversation. What's
I'm
something,
glad.
yes, yes, this is definitely overdue for my platform. And,
Okay.
again, I'm so thankful that you're here. Let me ask you, what's something you wish every endocrinologist, oncologist, or neurosurgeon understood about their patients' mental health, but often don't?
You trying to get me in trouble with my colleagues. You know, I think um I think the people who do this work and who go into this field care tremendously about their patients. I just think that both from the patient and the doctor perspective, a certain amount of this stuff that's happening, we feel like, oh, those are known side effects. Oh, that's known sequelae of this illness. Oh, this is like a known thing that happens. You are going to be more tired. You are going to have brain fog. You are going to have creaky joints. You are going to have, whatever the symptom is. And these doctors are very focused on getting your numbers right. They're focused on their job, right? And their job is to make sure that tumor doesn't grow, get it out if it does, um, keep your numbers in line because those numbers have medical impact on your body, right? So the blood sugars and all these things, they're watching your liver, they're watching your kidneys. My job, and this is kind of how I made this work my own because I did not want to be a doctor, I wanted to be a writer. But my job is to understand what's going on medically and then help the patient and the doctor find solutions. We work together as a team, it's very collaborative. Um, help the doctor and the patient find solutions to the specific problems. And I tell people, people will say to me, but see, like, there's always something else. And I go, yes, yes, absolutely, because that's life. If it wasn't this, it's going to be something else. Life is about problem solving. And when we take what has happened to us and we frame it as I'm broken, that doesn't lead to solutions. When we take what's happening to us and we go, okay, in this period where we've recovered from surgery and we've got the acromegaly, I, as an individual patient, have this symptom and this symptom and this symptom, but the one that bothers me most is this one. Because one person will be bothered by one person who doesn't care about that, they're bothered by another because it's all based on what matters to us. And so the first thing I'll say to people is like, "Hey, what if I could take only one thing down for you, what would that one thing be?" And then we problem solve. And problem solve means that we will try medication to fix, in your case, you've mentioned brain fog a couple times. So let's use that. If you have brain fog, the first thing I'm going to ask you is 5 million questions about how you function in your day. Because I don't take anyone's word for it that it's brain fog. It could be many things. It could be there are word finding difficulties that are related to processing speed. There's frontal lobe dysfunction, which is more organization and planning and focus and attention. And some of my patients will come to me and be like, I think I have dementia now too. And you're like, no, no, no. Until we diagnose you with dementia, you don't have it. But you may feel like it because you may have memory issues that are fairly significant, right? We know that hormones profoundly affect the communication between parts of the brain, right? Like communication is lubricated by hormones and neurotransmitters. And so one of the things that is fun for me is kind of doing the detective puzzle work of in your particular case, where are we having some slowing down? Where are we having some issues? And then even more fun for me is to find medication that treats that specific um, pathway or those specific pathways, and you tolerate it and you still feel like you, right? And it's a bit of a challenge. It's kind of a Rubik's cube of a thing, but it works. We try things. The people come back to me and they go, "Well, I had this side effect," and they're a little upset because they think that now there's no hope for them. And I'm like, "No, no, no. That side effect tells me that your brain liked this bit, but it didn't like this, and we need to switch to something that does more of this." And then we switch over and we move on and we get to solutions. And the more we get to solutions, the more I see people's eyes kind of light up with the hope that maybe this is just like a chronic illness and we have to do some problem solving. And maybe, just maybe, I'm not actually broken, right? And that's where I want everyone to go.
I just left California 2 days ago. I was out at Stanford at
Hmm.
Pituitary Patient Day. I really wish I would have swung by Santa Monica and had a consultation with you because
Well,
this
you're
is a
my
lot of good
VIP now,
stuff.
anytime. Yeah,
Yes,
yeah,
yes.
anytime.
Let me switch gears a little bit. You support
Okay.
patients not just through treatment, but sometimes through end of life conversations. How do you help people find peace when the outcome
Uh,
isn't always what they hope for? And on the flip side of that, how do you help someone who survives but doesn't feel like the same person anymore?
Okay, so you're not gonna take it easy on me, Tony. So that's good. Um, all the things, all the things. For the end of life, because that is a part of any conversation related to brain tumors or cancer. Even if our life isn't ending, there's that moment where you're told that you have this thing in your head, whether it's benign or cancerous. Um, Shoves your mortality in your face. All of a sudden, you're like, "Oh my gosh, I was gonna be a ballerina, and now I'm 36 and I haven't done it," you know? And that's a bit of a silly example because there aren't that many 36-year-old ballerinas, but, I think, um, our mortality gets shoved in our face whether or not it is end of life. So those conversations, the earlier that they happen, the more we take the elephant, in the room and talk to it and make it our friend and be like, look, like this has changed my perspective on my life. It has changed my perspective on what I want to do and who I am because somebody came in the room and made me realize that life is finite, right? Um, so I think that conversation early on, if we can set the tone, and that is something that I wish that doctors thought about, setting the tone of it's okay to have this conversation. It's okay for us to talk about this. Obviously, doctors are who are treating these diseases are very vested in you living. They want you to live. They want to try. But I think being able to have that conversation is super important because it makes us less frightened when we take it out of our head and put it out there. When we get to actual end of life, there's so many of my colleagues who get involved. We have lovely palliative care doctors. We have oncology social workers who work with the not just the patient, but the family. Um, the patient is going through a transition, and the family is anticipating this transition and having their own emotional state. And what we don't want is for patients to feel responsible for that, right? So a lot of support around people who love you and your caregivers, and who at this phase suddenly start to have their own fairly large responses to things. And um, I think if we can take that off the patient's plate, that is peaceful. If they know that their loved ones are being supported, that does bring some peace. And then, making sure that people understand that they have options, they can be in control. They don't have to be in pain. They don't have to, um, lose themselves. They can have advocacy for themselves. They can talk about it, and we can make sure that what they want is respected. I think that really helps. I think all of us innately want control throughout our lives. There's no reason why at the end we should suddenly lose all control and everyone else is in charge. Doctors and nurses and hospitals are in charge of us. It it doesn't have to be that way, and I think that our team, including me, work very hard to advocate for um, what a patient wants, especially when they're getting to the point where they might not be able to say themselves. We definitely act as their advocates. So end of life comes into the picture right when you're diagnosed, and um, that doesn't mean that we're dying. It just means that um, our mortality is something we're more aware of. Sometimes it makes us live a little bit sharper and sweeter and better, if we talk about it and we take the fear away.
One of the
And
hardest parts of
yeah,
chronic illness is the
hmm,
uncertainty, the
yeah,
waiting, the
yeah,
labs, the
yeah,
scans. How do you help patients live in that in between space without it
yeah.
consuming them?
Well, I think if you educate people on what a normal response is, and the fact that all of us have a lot of trouble with uncertainty, um, I myself being a control freak, don't do uncertainty well. So I've had to learn. Um, my patients are very dear to me, so their uncertainty becomes my uncertainty, and that's very hard. So it's a learning process of watching how you react. In that time when before you go get the scan, in the time after you get the scan, but you're waiting for someone to call you, in the time after the results. Some of my patients will get a good result, and it actually makes them more anxious because the good result means that we're okay and we can go back to our life, but it doesn't mean enough because it never tells you like, "Hey, this is never gonna come back and you're cured and congratulations." Like, that's not really something that we say to people. We just say, "Okay, now we're good until the next scan," right? So sometimes that scan being over means now we gotta wait till the next scan, which is now quite far away, right? So we call that, anticipatory anxiety, and that has a lot more to do with how people talk to themselves, how people process anxiety, how people were raised. A lot of us were raised in cultures where we're waiting for the other shoe to fall anyway. That's just how we were raised. And so in those cultures, um, now the shoe has fallen, but we're pretty sure there's other shoes up there. And so are we spending our life waiting for shoes to fall? And if that's the case, is that what we want to be doing? So a lot of our talking is around reframing what people tell themselves that drives the anxiety. And so, and what is the evidence to the contrary? What is the evidence that we are okay? And developing that sense of we are okay, we are okay. And that is something called CBT, cognitive behavioral therapy, where we reframe our thoughts, kind of keep the useful ones and toss the rest. And that has been shown to be extremely helpful for this particular kind of anxiety.
You mentioned control freaks. I am a control freak.
Yay, welcome to the club.
who's very impatient as well.
Uh-huh.
What are some practical tools that people like you and I could use when their mind starts spiraling?
Okay. Um, well, I'll tell you one that I use. You can, uh, I call it emotional vomit, but you basically like write out everything that you could possibly think that is bad or wrong or going to go wrong or scary. Okay. You just vomit it all out onto paper. And then when you're done, the game is to look at those statements and find evidence that proves otherwise. So you go from being um, the person who is creating the spinny to the person who is prosecuting the spinny. And you're like, well, the evidence for this is not good because I was able to go. I'll just use you as an example for the sake of your listeners. Um, I can't, get anything done anymore is a common one people say, right? And I would write it down. You go, I can't get anything done anymore. My brain isn't working well. Nothing works for me anymore. I'm so frustrated. I can't do this. And then we go through and we go, okay, I can't get anything done anymore. Well, what's the evidence against that? Because you're the prosecutor. Um, I went to Stanford. I was there for a couple of days. I was able to do advocacy work. I was tired. I did have brain fog, but I did it. And I came back and I feel it was successful for this reason and this reason and this reason. Um, you have now talked back to that thought, which in the process of speaking back to your own thoughts, there is an inherent value because you're questioning a thought. So you're sending a message to your brain. Hey, maybe every thought that I think is not actually valid. Maybe I think some really nonsense thoughts sometimes, right? Just the fact that your own brain questions itself means that you can take down the legitimacy of the spinny. I just call it the spinny. I don't know what to call it. Um, but the point of that is it's kind of like a top, if a top is spinning and then you press it once and it kind of slows down, then you press it again and then it kind of slows down. At some point you're going to slow that top down enough that it doesn't have spin and it falls over. So this does not happen easily. You have to do it over time and you have to keep doing it and you will think that it's not going to work and it's kind of dumb. But what we have shown is that over time, the brain wants the easiest pathway. So when you keep putting up resistance against this automatic thought, at some point the brain goes, dude, this thought, every time I try to have this thought, he has 14 things to say. I'm just not going to do that pathway anymore because that pathway is not efficient. And all the brain cares about is automatic pilot and efficient, right? So every time you put up resistance, you are teaching the brain that this pathway is not efficient and not easy and not automatic and not good. So it will automate something else. And that's how you do it. You rewrite it for yourself. That is one way. Another way is to
So,
move your body. You move your body, whatever way you can move your body, because I know brain tumor patients have limitations sometimes, but I don't care. You could be moving your fingers, you could be moving your hands, you could be moving your head, whatever it is, you move your body, and the spinnies come out in the movement. Movement is great for anxiety. It's great for the spinnies.
okay, we've got to move our bodies.
Yes,
Dr.
sir.
Gowrinathan, you work with a team of doctors. How
Yes.
important is it to treat the brain and body together instead of separating them?
Well, I think um, I think nothing in endocrine is separate from anything else. It would be silly to assume, particularly pituitary and acromegaly, because the pituitary is like the master gland and it is giving instructions to glands all over your body. Those glands are sending feedback to the brain and the pituitary, and then that is impacting that function. And so I think acromegaly and pituitary patients, more than anyone else, are very much aware that this little thingy in the brain and this body are extremely connected. I think the part that's important to emphasize and the part that is why collaborative care between doctors is important is that the medical stuff is also affecting the mind. right? So the mind is also being affected, the cognition is being affected, the daily living and how hard that is being affected. So, what is important, I think anyone who has gone through anything endocrine understands the connection between the brain and the body. But the other connection is that these medical things that are happening all up and down here affect our ability to function in the world, how our cognition works, how our brain globally functions, and therefore how our mind functions, right? So and that truly, if you can throw the mind in there too, you mentioned the body, you mentioned the brain, if you can throw the mind in there too, then that is whole person care. Once you've done that, then you've got whole person care. And it's just about listening to the parts of us that are telling us they need help. It doesn't matter where that part is, whether it's in your mind or your body or your brain. The parts of us that are telling us they need help, we just have to listen and then problem solve.
I'm going to take a step back to something you touched on a little bit earlier regarding relationships. How does chronic
Okay.
illness reshape relationships with spouses, kids, friends, and what conversations should patients not be afraid to have in those relationships?
Well, I think you have to know yourself first, right? So this big thing happened and it didn't happen in a vacuum. It happened in the context of your life, which means it happened in the context of relationships with other people. But I think as you get to know your new self, as you help your new self, you are helping your relationships because a lot of what happens is the dissonance between us not liking ourselves very much or understanding ourselves right now and maybe feeling distance from the people because they either fell in love with the person you were before or they're your family and they just want you to be that person you were before. And so, in order to speak articulately to people you love about what you need now or what is different, but you're still the same person, you have to be able to feel that and understand it first, right? So, I always tell people, um, we can talk to people and ask for what we need along the way, but we really have an obligation to help ourselves and then allow that to heal these relationships, right? Like, we can't assume that the relationship is now defunct or terrible or the person is terrible because we are not okay right now. So, whenever people are not okay right now, I'm like, wait on the relationships, wait till you have reestablished a connection with yourself and then see how that impacts those relationships. And if they still are not okay, if people are perhaps not as supportive, or there's something you need, or that relationship isn't really working in this new context, then you have something to say. And then you can say it with a great deal of confidence.
For the caregivers, what's something they need to understand about what their loved one is going through mentally?
Mm, I think for most of us, it's hard to be dependent. It's hard to not be able to do for ourselves. And I know that when you're afraid of losing your loved one, you're gonna hold on tighter, right? That's what we do. We love someone, we're afraid of losing them, we almost lost them, they had to go through surgery, and we had to sit in a waiting room somewhere, which is, like, probably the hardest thing a loved one has to do, and then and watch us sort of struggle on the other side. Um, Being as non-judgmental as possible under the circumstances is good, but I think also, um allowing people to feel what they're feeling. So I know a lot of patients feel very alone when they're looking better and they're a little bit stronger. And then people are like, oh, but you're fine. But you're fine now. You had the surgery, you look better, you're fine now. Fine now means that they need you to be fine now. Fine now does not mean that you are. And so it becomes isolating because there's this expectation that we go back to being fine, but we're not there yet. So I think my favorite thing to tell the people who love the patient um, is there has to be space for them not to be okay still. There has to be space. That's it. And then we can, move out of those spaces. But if there's no space, then the person feels very isolated with their continued distress because nobody wants to hear it. Everybody wants us to be okay. Right. So making space for that, I think, and understanding that it's a long journey, it's not a short one.
That is great information, Dr. Gowrinathan. One thing that patients, you believe, are too hard on themselves about. We've been through uh, brain surgery, pituitary surgery. What is it that we need to not be so hard on ourselves about?
Mm, I don't know. I don't know. It's so person dependent, really. Um, I think the one thing that's hard to have patience for is that recovery takes a lot longer than we want it to. Maybe not longer than it's supposed to. The doctors will tell you, well, yeah, I was supposed to take this much time, or you're not there yet. But, you know, it's a bit like that time period if you break a bone and you have a cast and you're now feeling stronger and you're not in pain anymore, but it's not healed and you want that cast off and it's starting to itch actually because the bone is knitting itself back together. You are in healing, but healing is kind of uncomfortable and healing takes a long time and we just want it to be done and it's not. So I think in that time giving yourself grace and there might be mushy days and then there might be good days and not making the mushy days sort of into some sort of pathology or see it's never going to be good again and just being like, okay, I'm going to have some good days, but I'm going to have some mush days too. And then I'm looking forward to the day when the good days outnumber the mush days. But I'm not there yet. I'm not there yet because I'm still healing, right? Like grace for that time period, that in between time period, which all of us are impatient and want to skip through. But there's no skipping.
There is no skipping. Let me ask you this. Is there a habit that can improve mental health during illness quickly?
The two that I'm aggressive about treating are sleep because it's the brain, and the brain is highly dependent on sleep for healing. So, more so than the rest of the body, I think. The brain really doesn't do its work of healing until you are in deep sleep. So, if we can get you really good sleep, that really matters much more than I think people give credit for. It matters. You should be getting deep good sleep, and that it's a hard thing when you have acromegaly or when you have endocrine disorders because one of the things that dysregulates is sleep. Um, and the other thing is movement. And movement can be as small as you want it to be. If you have a lot of difficulty with movement, you can pick something super small. You can sit in your chair and wiggle your booty. I don't care. But I think that um, movement connects us with our body. So if we can move, if we can dance for 5 minutes with our kids, or we can, bop to a song, or we can go for a walk, these are things that make us feel a little bit more normal, a little bit more like we're living in our body and we're okay. So those two things, movement and sleep, I think are underappreciated.
I can dance, I can bop. I don't sleep well, but I can move a little bit. Let me ask you this,
Okay,
Dr.
so now all you
Gowrinathan.
got to do is take down the sleep and you'll be good.
Yeah, that's the hard part. I'm working on it. Hopefully that
Hmm.
gets better much sooner than later. If someone is listening right now, feeling overwhelmed, scared, and unsure how to keep going, what would you say to them right now?
That's okay. It'd be weird, not to be daunted by all of this. Um, I think I think if you have support wherever you're getting treatment, if you have support from people like me and our social workers, our jobs is to believe that you can do it and believe that you're gonna get better and believe that there's gonna be a day when you're not overwhelmed, when you're not able to do that, and then walk with you till you get there. So I guess if you're feeling that stuck or that overwhelmed or just I can't do this-ish, um, seek support. In whatever form is available to you, seek support. And if one form of support doesn't work for you, that doesn't mean that there isn't support for you. You got to try, right? Like we got to try till it fits, right? So, not to assume that because the first version that you tried didn't work, that it's just not meant for you and there's no hope. Um, you know, it's like trying on clothes. You got to find the one that fits for you. So, you keep trying, you keep asking for support until you find the one that fits you. And I thank you for creating this space for people to have support. Your podcast is part of that process.
Thank you. And this conversation was long overdue for my podcast.
It's so good to meet you, Tony, and to get to talk about this. I appreciate it. And God bless to you and all people who are going through this with you.
Dr. Gowrinathan, this has been one of the most important conversations I've had on this platform. As patients, we often become so focused on surviving physically that we forget our emotional health needs care too. For everyone listening who has ever felt overwhelmed, isolated, or emotionally drained by the diagnosis, I hope this conversation serves as a reminder that your mental health matters just as much as your physical health. And seeking support is not a sign of weakness. It's a sign of wisdom. If you found interest in this episode, you can show support by hitting that subscribe button, like it, share it, and or leave a comment. You can also follow me on all my social media platforms. Also, stick around. I think you'll find interest in hearing from an internationally respected endocrine leader. So click here and watch my conversation with Dr. Christine Jedinek. Thanks for watching.